Hello, my name is Lewis Jones, and I'm a MSN student at Liberty University, nurse educator track.
I'm Markeisha Ellison, a nurse practitioner, Master's of Science in Nursing. I work at Lakeside Behavioral Health Services.
All right, today I'm going to get started with the full head to toe assessment. Starting with the skin. I already washed my hands prior to this video. So right now, at this moment, I'm going to assess the skin. Skin is normal with ethnicity. It's warm. He has no lesions or levi noted. Brisk skin turgor. No hair distribution coming down to his lower extremities. He has equal hair distribution. It's warm. No evidence of lesions or nevi. No signs of edema. Skin turgor is brisk. Okay. Coming back up to kind of look at his fingers, check his capillary refill. They're less than 3 seconds. Nail beds are attached to the fingers. No clubbing noted. Coming down to his lower extremities. They're less than 3 seconds. Nail beds are attached to the toes. No clubbing noted. Coming up to his head, I'm looking around. I see his hair is evenly distributed. Palpation of his scalp. Looking for nodules. No scars or anything to that nature. Coming down, palpating his face. Face is symmetrical. Palpating his paranasal sinuses, his frontal sinuses, and his maxillary sinuses. Do you feel any pain?
No.
Okay. Now I'm gonna palpate that. So now I'm looking at his eyes. His eyebrows are evenly symmetrical. Eyelids are evenly symmetrical. Palpating his lacrimal sac. Inside of his conjunctiva looks moist, pink. Sclera looks white. Lacrium apparatus looks good. His iris. All those are normal findings. And right now I want to take the time to kind of discuss the Snellen chart. The Snellen chart is basically used to test the patient's visual fields. And I want to take the time to discuss the Rosenberg, which tests the near vision and the reading literacy as well. So right now I want to assess his pupils. Pupil are constriction from 3 centimeters to 2 centimeters. Now I'm checking his consensual reflex. Both eyes are constricting. So now I'm going to take the time to do cover, uncover. So I'm going to cover up this eye right here, and I'm going to shine the light in this eye, and I'm going to see if I can see any constriction. Okay. So right now, I'm assessing cranial nerves 3, 4, 5, and 6. This cardinal field of gauge. So look at my finger, follow my finger. Good job. So now I'm gonna take a look at his optic disc. Look at his retinas. Okay, the optic disc appears to be round. I don't know how many centimeters, but very small. And I'm looking for the red reflex. I see the red reflex. Other optic disc is round. Don't know how many centimeters, but I'm looking for the red reflex. I see the red reflex. Looking at the retinal, I don't see any hemorrhage or exudate. Looking at this retinal, I don't see any hemorrhage or exudate. All right, looking for the cornea reflex. Cornea reflex is intact. Cornea reflex is intact, bilateral. Moving on to his ears. Alright, so now I'm starting with palpation of his ears, his ocular. I don't feel any nose or nodule. Palpation of his mastoid process. Don't feel anything abnormal. Now I'm gonna take a look in his ears. Alright. His ear canals are clear. Tympanic membrane is pearl white. And I see the cone reflex. Alright, looking in his left ear. Ear canal is clear. I see the tympanic membrane is pearl white. And I see the cone reflex. And I recently forgot to mention also with his eye exam, the confrontation portion, testing his peripheral fields. So you can look at my finger and tell me how many fingers I'm holding up.
1. 1. 2. 2.
Good job. So now I'm finna perform the whisper test. I'm gonna whisper a number in both of your ears, okay? And you can just repeat it back to me.
15. 22.
Good job. So now I'm finna test the Wines and Weber's test. That's basically air conduction versus bone conduction. I'm gonna start by striking this tuning fork. I'm gonna set it in the center of your head, and you tell me if you hear it in your left or right ear, or you hear it in the middle.
The middle.
Good job. Now I'm finna assess air conduction versus bone conduction. Okay, let me know if you hear it more in the air or more in the bone.
Air. Air.
Good job. So while I'm here, just gonna go ahead and do an assessment on checking if you can feel any vibration, okay?
Yes. 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 Yes.
So now moving on to your nose, okay? Your eyes are symmetrical. Your nose is in the center of your eyes, okay? And it's above, and it's midline of your mouth, okay? So now I'm gonna look at your turbinates and your nasal passages, okay? Get back. Alright, nasal passages are clear. I don't see any evidence of exudate or blood. And at this moment, I would assess his olfactory nerve but at the moment we don't have anything to kind of smell. Alright, so now I'm gonna assess your mouth. Okay. His lips is pink. Can you open your mouth for me? Lips is pink, no evidence of cyanosis. Hard palate and soft palate is pink. Looking at the Wardens and Stinson's ducts. Okay, lift your tongue up. Looking at the frenulum. The frenulum is midline of the back of the tongue, the bottom of the tongue. Okay. Now say ah. Okay, uvula rises and falls to the center of the tongue. Okay. So basically, I just assessed his glossopharyngeal, and at this moment, I'm gonna assess his vagus nerves. Okay, can you swallow for me? Okay, throat is midline. I'm going down to your sternum notch, and I'm gonna palpate your trachea. Okay. Trachea moves freely. And now I'm gonna assess his hypoglossal cranial nerve, okay? Can you lift your tongue that way? Lift your tongue that way. Lift up. Lift down. Good job. And usually I would take a tongue depressor and I would move his tongues in that motion to kind of assess his tongue movement as well. So now I'm at his throat. I mean his neck, excuse me. So okay, his neck is symmetrical. His head is normal cephalic. Everything is symmetrical. Right now I'm gonna palpate his preocular lymph nodes. His ocular lymph nodes. His occipital lymph nodes. His submandibular lymph nodes. His sublingual lymph nodes. And his submental lymph nodes. No evidence of swelling or anything of that nature. So now I'm gonna assess his trigeminal cranial nerve 5. I'm gonna ask him to clench your teeth for me, hard as you can. Can you move your jaw from side to side? Good job. All right. And now I'm gonna assess his cranial nerve 7, his facial nerve. Can you raise your eyebrows? Good job. Can you smile for me? Show your teeth. Puff out your cheeks. Purse lips. Good job. So he has symmetrical face expression. So now I'm gonna assess his cervical nose chain. No evidence of swelling or anything. Right now, I'm gonna inspect, and palpate, and assess his carotids and his thyroid. All right, gotta come behind him and assess his thyroid. Alright. I'm gonna listen to his thyroid and his carotid. Alright. So now I'm gonna ask you to lean your head forward, backwards, left, right. Okay. So now, moving on to the lung portion. Right now, I'm looking at him. He's relaxed. His his chest is rising and falling normally. Palpation. I don't see any heaves or any hard work of breathing or anything. So now I'm gonna percuss his chest fields. Alright, so while I got him right here, I'm gonna go on ahead and check for thoracic expansion. So I need you to take a deep breath. Good job. So my hands spread apart when he breathes or whatnot. So while I'm here, I'm going to check for tactile premises. Okay. So I'm gonna place my hand here, and I need you to say 99. Okay.
99.
Good job.
99. 99. 99.
All right. That's good. So now I'm gonna auscultate his anterior chest. Job. All right, go ahead. Can I ask you to kind of swing around this way? And I'm gonna get back here and I'm gonna check your diaphragmatic excursion. All right, ready? All right, residence in his lung fields. So now I'm checking for your thoracic expansion. So give me a good deep breath. Good job. All right. So now I'm gonna listen to you, your lung fields anteriorly. All right, deep breath. Good job. Good job. Good job. Bronchial and bronchiovestibular is clear anterior and posterior. All right. So turn around that baby down for me. So right at this moment, I'm kind of palpating. Don't see any heaves or any hard work of breathing or anything. Okay. Palpating for the point of maximal impulse. So at this moment, I'm gonna assess his pulses, starting with his carotids, 2+, his brachials, 2+, radius, 2+, his popliteal, 2+, dorsalis pedis pulses, 2+, and his posterior tibia pulse, 2+. So now I'm gonna listen to his heart sounds, starting with the aortic, first point. Mitral. Switch it to the bell. I'm listening for murmurs and bruits and any abnormal heart sounds. So I'm gonna okay, no evidence of S2 and S4, no murmurs, no bruits, anything. So now, I'm gonna take a look at his abdomen. So his abdomen, he has a few marks on his abdomen, or whatever that, I will note that in my assessment. Right now, it's flat, it's not round. I'll start by auscultating his abdomen for vowel sounds. Vowel sounds are present, so I'm finna palpate. Soft palpate, not deep palpation. Does it hurt?
No.
Okay. So right now, finna locate and measure his liver by percussion. Excuse me. So I'll make a mark here, and I'll start at his lower right quadrant and palpate and percuss up till I hear a dull sound. So I will take another mark and mark here to kind of locate where his liver is located. So now I'm going to palpate his liver. Now I need to locate where his spleen is located, okay? So I locate by percussion. So this is where his spleen is located. So now I'm gonna palpate his spleen. Okay. Try to locate his kidneys. I can't feel his kidneys, and these are abnormal. These are normal findings, excuse me. So right now, I'm in his musculoskeletal system. So now I'm gonna assess all his joints. So from his fingers, no evidence of clicking or anything. His elbow, shoulder, no evidence of clicking or anything. His knees. No evidence of clicking or abnormal movements. His other knee. His fingers. Elbow. Shoulders. No clicking or abnormal movements. What about your wrists? Alright. So right now I'm gonna assess your biceps and triceps strength, okay? So try to pull my hands up. Good job. Now relax. Don't let me pull you down. Good job. Okay. this wrist? Let me keep that wrist down. About to push up on your wrist. Good job. What about this one? Alright, can you spread your fingers for me? Alright, can you wiggle your fingers? Good job. So, alright, don't let me have these two fingers touch, okay? And these two fingers, because right now I'm assessing your strength, okay? Don't let me pull these fingers close together. Good job. What about these fingers? Good job. What about these fingers? Good job. Alright, so now we can sit on the side of the bed. So alright, so right now, I'm assessing your hip strength, okay? So, don't let me push your feet up. Alright. Don't let me keep your feet down. Let me keep your shoulders down. Good job. Alright. So now I'm assessing your joints. Alright. So do not let me lift this leg, okay? Good job. Alright, relax. Do not let me push this leg down. Good job. Do not let me lift this leg. Good job. Do not let me push it down. Good job. Alright. So push down on the gas pedal. Good job. Push up. Good job. Can you rotate your ankles? Good job. Alright, we're gonna lay back on the bed. Alright, so I'm laying back. So I'm gonna take this knee, I'm gonna put it to your chest. We're gonna push it to the window, push it to the door, okay? Alright, ready? Let's go. Knee to chest, toward the window, toward the door. Straighten it out. Good job. Alright, this one. Knee to chest, toward the door, toward the window. Straighten it out. Good job. Alright. So now, right now, I'm gonna assess your cranial nerve 11, spinal accessory, okay? So, I'm gonna push down on your shoulders. Don't let me push your shoulders down, okay? Shrug. Pushing down. Alright. Relax. Alright. Now, I'm gonna put my hand against your face, okay? I'm gonna try to push it towards this way. So, don't let me push it toward that way, okay? Alright, 1. That way, 2. Don't let me push it forward. Don't let me push it back. Good job. Alright, so now we can come. Stand up. Stand up. Alright. Can you bend over for me? Alright, so right now I'm assessing the spine. Spine is aligned. Everything is symmetrical. No evidence of scoliosis or kyphosis. Alright, let's stand up. Step up some. Lean back as far as you can. Good job. Alright, that's good. Alright, set that real good. So now, alright. So now I'm in my neuro portion of my exam, okay? I'm at the neuro portion. So do you know your name? What's your name?
Connor Jackson,
Good job. You know today's date?
March 8th, 2019.
Okay, when is your birthday?
May 21st, 94.
Alright, who the President of the United States?
President Trump.
President Trump. So my patient is alert and oriented times 4. Okay? And right now, it says basically right now it says his joint. It says his reflexes. Okay? Start here with his tricep reflex. Okay, it's intact. Okay, his bicep reflex. Good job. And his brachioradialis reflex. reflex. Can you hold your hand out for me? Alright. Flip them over. Okay, I'm about to draw 2 numbers in your hand, okay? Close your eyes.
11,
Good job.
9,
Good job. Okay. Can you hold your hands on your legs? Now can you real fast, rapidly, supinate and pronate? Real fast, rapidly, supinate and pronate. Good job. Okay. Now lift off one thing in the musculoskeletal system, okay? Can you hold your arms straight? Got a review over that? Alright. So don't let me push your arm down, okay? Good job. Now relax. Don't let me push it up. Good job. Now, don't let me pull it up. Good job. Alright. So, get the vibration, get it, or whatever. So, okay. Close your eyes. Let me know when I'm touching you, okay?
now. Yes. Yeah. Yes. 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 Yes.
Alright. Can you stand up for me? Alright. Turn around this way. The other way. The other way. Alright. Feet shoulder width apart. Alright, close your eyes. Assessing for the Rumberg sign. Close your eyes closed. Feeling any drifts? I don't see any drifts, any evidence of neurological deficits. And alright. And I need you to walk heel to toe for me, okay? Patient gait is normal. Alright, take my 2 fingers. Give me a good squeeze. Good job. Alright, push this gas pedal. Push this gas pedal. Push up. Good job. Alright. Alright, so, okay. It's alright. Touch my finger. Touch your nose. Touch my finger. You gotta do it fast in there. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Good job. And that will conclude my full head to toe assessment. Thank you guys for watching.